Hello, my name is Professor Blumenthal. I will describe briefly what happens on the visit before a cataract surgery. Very often a patient will schedule an appointment in my office after he or she have been told that they have a cataract and they need surgery. The patient will often arrive after another physician, maybe a primary ophthalmologist, has diagnosed cataract, and after several exams that from one to the other, the patient was notified that cataract is slowly getting worse. At a certain point in time, the patient was told, you need surgery. They will approach my office, and in that exam, we will do several things. First of all, I will learn something about the person and about his or her visual requirements. And just to give an example, a person who drives a lot may need his cataract to be done a little bit earlier than a person who mostly watches TV and reads. This is because cataract affects your driving vision more than it does your reading vision. After learning something about the person, I will do a very thorough exam of the eye. And in this exam, I have several goals. First of all, I want to diagnose that indeed there is a cataract and that it is ripe, that it is ready for surgery. Number two, and perhaps even more important, I want to make sure that the reason that that specific eye doesn't see is because of a cataract, and not, for instance, because of some other eye disease. And the reason is that, first of all, that other eye disease, if it exists, needs attention. And number two, there are certain things during surgery that we may do to compensate for the fact that this is not a healthy eye with cataract, but an eye with other conditions. Number three, we want to ascertain that indeed taking out the cataract, removing it, is going to improve the vision. Because, for instance, if a patient has two diseases that coincide in the same eye, sometimes merely removing the cataract is not going to give any more vision back, because the reason for the decreased vision is that other disease that may or may not exist. Towards this goal, we have a specific exam that helps us to predict what will the visual acuity be should we remove the cataract. This is only an approximation, doesn't give a precise answer, but it does tell you ballpark where you're sitting. And in specific patients that seem to have only a normal eye with a cataract, when this test, this visual acuity potential test, shows that there is no visual acuity potential in the eye, we would look much more aggressively and thoroughly to look for other conditions that cause this eye not to see. And often when we use the combination of all these tests that we do prior to a cataract surgery, we feel that we are approaching the surgery for a more certainty point, which means we know how to treat that eye specifically better than just the average eye that goes into a cataract surgery. At the end of all these exams, the patient will sit with me. I will provide an explanation of what I found, what I believe should be done, and what the options are. And should the patient decide that cataract surgery suits their plans, I will fill all the paperwork, insurance forms, and all the other relevant things, and the next time I'll meet the patient will be on the day of surgery. Good luck.